Hello and welcome back to the StarTimes Daily COVID-19 report. Here's where we'll bring you the latest news and developments on the coronavirus. We'll also be sharing some health and safety advice on how you can avoid COVID-19 infection. I'm James Oliver. First up is today's COVID-19 by the numbers. As of April 2nd, more than 1.27 million coronavirus cases have been confirmed worldwide. The United States has the most confirmed cases, with the numbers across European countries also increasing. Worldometer reports as of April 6th, there are 1,271,875 cases confirmed, with 69,405 deaths and 261,424 recovered patients reported globally. The latest information indicates that there are 208 countries and regions which have reported cases of COVID-19. In France, a new approach to statistical analysis has led to a sharp increase in the reported number of confirmed COVID-19 cases. At present, the number of confirmed cases in France has reached 92,839, placing it at fifth highest in the world. 16,183 patients have already recovered, while the total number of deaths has reached 8,078. The number of deaths in Paris alone has now surpassed 2,000. On April 5th, French Director General of Health Jérôme Salomon released a more complete statistical report, which now includes comprehensive data from hospitals and care homes. The previous official reports only included data from hospitals. Britain's Queen Elizabeth II addressed the nation on Sunday in a rare televised speech and called for unity amid the coronavirus pandemic. The Queen said it's an increasingly challenging time and thanked everyone at the National Health Service, as well as care workers and those carrying out essential roles. She also thanked people for staying at home. In an address to the English people, the Queen stated, "We will succeed, and that success will belong to every one of us." The speech marked only the fifth time that Queen Elizabeth has spoken on television outside of Christmas since taking the throne. The coronavirus global outbreak continues, with more than 100,000 cases confirmed in Germany and 330,000 cases confirmed in the United States. Germany has become the fourth country in which confirmed cases of COVID-19 have topped over 100,000. That's according to the latest data from Worldometer. The country's death toll has increased to 1,584. Helge Braun, head of the Federal Chancellery, has emphasized that the peak of the corona crisis in Germany is still to come. The U.S. is still the worst hit country by COVID-19, with the number of coronavirus cases exceeding 330,000, and the death toll has reached 9,605. President Donald Trump has extended social distancing guidelines to April 30th. The good news is that the number of infections and deaths in New York State is dropping for the first time. That's according to CNN reports from Monday. New York State is the epicenter of the U.S. coronavirus outbreak. This decrease offers hope to New Yorkers, though they remain uncertain if the number of confirmed cases is yet to reach its peak. Some good news out of Italy. There have been a decline in the number of new confirmed coronavirus cases. This decline also marks a drop in intensive care cases and a drop in the number of deaths. These decreases may indicate that the prevention and protection measures being taken are proving effective. However, there are still some people disobeying the lockdown rule. Italy has recorded its lowest death rate in a 24-hour period since the outbreak. That's down to 525 new deaths, according to the Italian Civil Protection Ministry. So far, Italy reports 128,948 cases in total. 21,815 people have recovered from the coronavirus. That's an increase of 819. Meanwhile, 17 patients have come out of critical conditions and have been released from the ICU. In recent days, there are more people coming out of their homes and disobeying the lockdown rules. That's amidst the slowdown of the outbreak. Italian authorities have pressed charges against 8,187 and cited 9,284 people for violating the decree imposed to contain the coronavirus on April 3rd and April 4th. That's according to figures from the Interior Ministry. The police have stepped up enforcement to compensate. On Saturday alone, fines for violating travel restrictions reached €9,300, the highest since the new fines were imposed from March 26th. In addition, the police are working on plans to set up checkpoints on major roads and on motorways leading out of towns and cities to turn back those attempting to break the rules by going to holiday places during the upcoming Easter holiday. On April 5th, China sent a medical team to the Philippines to share anti-epidemic experience with local health authorities. The Chinese government has sent in a team of medical experts to help the Philippines combat the COVID-19 pandemic, China's Foreign Affairs Department reported Sunday. The group, composed of 10 medical professionals and 2 Chinese officials, was welcomed by Foreign Affairs Secretary Teodoro Locsin Jr. on Sunday afternoon. The Foreign Affairs Secretary wrote on his official Twitter account, "The Chinese experts arrived with invaluable first-hand experiences to share on fighting and containing COVID. Thank you, China." Apart from the medical team, the Chinese government has also donated a fresh batch of medical supplies, including 300,000 surgical masks, 30,000 medical N95 masks, 5,000 medical protective suits, 5,000 medical face shields, and 30 non-invasive ventilators. The department added that the team is expected to share technical advice on the prevention and control of the infectious disease in the country. Now on to the situation in Africa. According to data from Worldometer, as of April 6th, there are now 51 African countries infected with the coronavirus, with over 8,000 cases confirmed across the continent. As of April 6th, there are now 51 African countries with confirmed COVID-19 cases. That's over 8,000 confirmed cases of coronavirus across the continent, with 334 deaths and 702 recoveries. South Africa has the most reported cases in Africa, with 1,655. On April 5th, South Sudan announced its first case of COVID-19. The patient is a 29-year-old woman who arrived in South Sudan from the Netherlands via Ethiopia on February 28th. The patient showed symptoms on April 2nd and tested positive on April 4th. South Sudan became the 51st of Africa's 54 countries to report the disease. At this time, only Sao Tome and Principe, Comoros, and Lesotho have not reported any cases. On April 6th, Kenya's national tally of infections rose to 142. The government extended the ban on international flights for an extra 30 days. As an exception, cargo flights without passengers on board will be allowed in. Today, Nigeria's confirmed coronavirus cases reached 232. As Africa's economic powerhouse, Nigeria has planned to set up a $1.39 billion fund to fight COVID-19. As of April 6th, Nigeria has confirmed 232 cases of coronavirus along with 5 deaths. Lagos State entered a 2-week lockdown on Monday aimed at slowing down the spread of the virus. On April 5th, the Nigerian government announced their plan to create a $1.39 billion coronavirus fund that's aimed to strengthen its healthcare infrastructure and tackle the virus. According to the statement, the Finance Department, House of Representatives, and Senate have reached an agreement. The Crisis Intervention Fund would pull in a cash loan from various special government accounts and get the rest from grants and loans from multilateral institutions. According to the nation's finance minister, this Crisis Intervention Fund is to be utilized to upgrade healthcare facilities. Yesterday, StarTimes spoke with Rukia, a Tanzanian national who's been working here in Beijing for 3 years. Rukia discussed her life in China during the coronavirus outbreak.
My name is Rukia Hamdan Suleiman. In Chinese name, I use Kechi. I come from Tanzania, Zanzibar. I'm here in Beijing since in the year 2017 for the aim purpose of working in my company. And now I see that the situation has decelerated. I mean, the rapid or the rate of infection of this disease here in Beijing and some other cities has reduced for somehow because the people has accepted the situation fast and took the measure in order to make sure that they live by following the guidelines and protecting one another. The company has provided the very necessary equipment like mask, We have been given a lot of marks to make sure that we are safe, we protect ourselves not to be infected. And also you are given sanitizer just to make sure our hands are clean. What I want to tell my people in Africa, this disease is very serious, and we have to take all possible measures to make sure that we defeat it. You know, unity is a strength, and we are together in this battle. And I'm sure we have to fight for any means in order to defeat it and to have a new era or a new chapter for Africa development. It is possible, and of course we can do it.
Now it's time for Staying Safe. Coming up next, we'll give you some knowledge and guidelines to help you stay safe from the coronavirus. In today's topic, why you should observe your symptoms carefully for 14 days if you come into contact with anyone infected.
Why should close contacts be observed for 14 days? The isolation period of an infectious disease is determined according to its incubation period. The incubation period refers to the time from the invasion of the pathogen to the emergence of clinical symptoms. Based on the current studies, the incubation period for COVID-19 is 1 to 14 days, and typically between 3 to 7 days. Therefore, the isolation period is set at 14 days. That is to say, 14 days after the last time the observed individual had contact with confirmed and/or asymptomatic infected patients without effective protection. At present, it is necessary to take preventive health measures, such as relatively strict isolation and medical observation for close contacts. These measures demonstrate that we hold a responsible attitude regarding public health and their common practices in the international community.
Well, that's all for today's program. Don't forget to tune in to StarTimes Daily tomorrow for the latest COVID-19 developments, along with some more health advice. Please stay home, stay healthy, stay happy, and stay safe. I'm James Oliver, and we'll see you soon.